Hello, Dr. Joe here of the 2020forum.com. So if you've been following me for a while, you know that I am obsessed with high blood pressure, and I am even more obsessed with management of high blood pressure with natural measures. So I want to know how well you've been following what I've been saying. So in today's video, we're going to be doing a high blood pressure quiz. Let's see how well you've been following me. The main question is going to be, are you on the sharp end of high blood pressure? So to this end, you're going to have 10 questions and you're going to have 7 seconds to answer each of those questions. And let's see how well you do. So let's get started.
Are you on the sharp end of high blood pressure? Question 1. How common is high blood pressure? Here is a statement for you. About a third of US adults suffer from high blood pressure. Is that statement true or false? You got 7 seconds. If you said false, you will be wrong. The answer is true. It is estimated that 1/3 of US adults suffer from high blood pressure. And in adults aged 65 and older, this number climbs to over 60%. It is estimated that 75 million Americans have high blood pressure. That is a staggering figure. Question 2. If your blood pressure reading is 130 over 75 millimeters of mercury, the top figure, i.e. the 130, represents the pressure inside your arteries when your heart muscle is relaxed. Is that true or false? You got 7 seconds. If you said false, you will be correct. The top figure represents the systolic pressure. The systolic pressure is the force that your blood exerts against your artery walls when your heart contracts. It is also the pressure inside the arteries when your heart pumps the blood out of it. That's another way of looking at the systolic pressure. The bottom figure represents the pressure inside your arteries when your heart muscle is relaxed. That is in between contractions. That bottom figure, we call it the diastolic pressure. Question 3. A blood pressure reading of 150 over 90 millimeters of mercury is considered high. Is that true or false? You got 7 seconds. If you said true, you'll be correct. A blood pressure reading of 150 over 90 is considered high by most countries' blood pressure guidelines. The guidelines recommend a target blood pressure reading of 120 over 80 and below. The American Heart Association, the American College of Cardiology, and 9 other health organizations lower the numbers for diagnosis of high blood pressure. But a reading of between 121 to 139 systolic over 80 to 89 diastolic is considered pre-hypertension. Blood pressure reading of 140 over 90 and above is considered hypertension. Question 4. BP reading of 180 over 120 millimeters of mercury under current guidelines should be ignored. Is that true or false? You got 7 seconds. If you said false, you'll be correct. Blood pressure reading of 180 over 120 or higher is considered hypertensive crisis under current guidelines. If you get a reading like that, do not panic. Relax. Check the blood pressure again in 5 minutes. If it is still the same, seek medical attention. Question 5. You may choose more than one answer if necessary. High blood pressure can damage the following: A. Your arteries, B. Your kidneys, C. Your heart, D. Your brain, E. None of the above. You got 7 seconds. The answer is A, B, C, and D. Something we hate about high blood pressure is that, for the most part, it causes no symptoms at all. Hence, it is also referred to as the silent killer. High blood pressure can cause complications in all of those organs without you being aware you got it. Occasionally, some people may experience headaches or dizziness as symptoms, but for the most part, a lot of people are totally unaware they have high blood pressure. Question 6. You may choose more than one answer if necessary. The following may increase your risk of developing high blood pressure. A. Eating highly processed foods. B. Having a BMI of less than 25. C. A diet that is high in sodium. D. Being physically active. You got 7 seconds. The answer is A and C. A diet that is high in sodium and laden with highly processed foods are risk factors for high blood pressure. Also, being sedentary is another risk factor for developing high blood pressure. Conversely, being physically active is one of the best ways you can deal with high blood pressure. Keeping your weight down and avoiding being overweight helps reduce your risk of developing high blood pressure. Those are preventative measures. Question 7. The concept of white coat hypertension is a myth. Is that true or false? You got 7 seconds. If you said true, you will be wrong. The answer is false. White coat hypertension is real. In fact, 15% of people may be misdiagnosed as having high blood pressure when their reading is high at the doctor's office. This is usually due to anxiety and stress. One solution is to recheck your blood pressure at home, so long as you follow the blood pressure measuring guidelines. Just take a couple of readings at home, know the time you took the readings, and take them to your doctor for review. Question 8. Sleep deprivation has no effect on your blood pressure. Is that true or false? You got 7 seconds. The answer is false. One common factor that causes high blood pressure readings is poor sleep. The quantity and the quality of the sleep matters a lot. Good quality sleep lasting 7 to 8 hours a night is essential for better BP control. One reason sleep is important is that sleep deprivation causes hormonal havoc, in particular cortisol hormone and adrenaline, both of which are bad news for your blood pressure when their levels are elevated. Question 9. You may choose more than one option. Regarding BP guidelines, you can measure your blood pressure 10 minutes after A. You smoked a cigarette, B. You drank coffee, C. You completed an exercise routine, D. Drank a glass of Jack Daniel's whiskey, E. None of the above. You got 7 seconds. The answer is none of the above. Doing so, you will be breaking a couple of blood pressure measuring rules. Please, you shouldn't smoke, perform any exercise of any sort, drink caffeinated beverages, or consume alcohol for at least 30 minutes before checking your blood pressure. Question 10. Diet is not effective in lowering your blood pressure. Is that statement true or false? You got 7 seconds. If you said true, you will be wrong. The answer is false. One of the best things you can do to manage your high blood pressure is to change your diet to a healthier one. Avoiding ready-made meals, processed foods, reducing your sugar intake, reducing but not avoiding altogether your salt intake, cutting out trans fats are some of the dietary changes you can make to lower your blood pressure readings.
So how well did you do? Hopefully you did well. If you got a score of 70% and above, very well done. That's what you should be aiming for. If you did worse than that, that's okay. There's always a chance for you to learn a little bit more. Now, if you enjoyed this quiz, please give the video a thumbs up. Please like the video. And also please share this video with your friends, family, and colleagues. Let them also attempt the quiz and let's see how well they know their high blood pressure. Hopefully, we're going to be having more quizzes like this in future because quizzes like this actually help you to consolidate knowledge about a particular topic. Now, if you haven't joined us yet at the 2020 Forum platform, go ahead and join us. It's free to sign up. Over there, we talk about high blood pressure, what else, as well as other wellness issues. One more thing, how about you share how well you did with us right down below in the comment section. Do not be embarrassed, it's okay. There's no shame in doing worse than 70%, but if you did very well, also do share with us. Be proud of yourself. I think that's about it. Until next time, well, this is Dr. Joe signing out.